welcome to the conclusion of our project on depression. Here we go. We pretty much explored the fact that depression is very multi-layered, right? No theory explains it yet. And what we really wanted to do was map out a patient's perspective in this thing and just make that contribution to the field in a way that we possibly could, perhaps adding to what is currently known about it and adding to, not replacing, current medical science, treatments, etc. In fact, we encourage those greatly and think they are perhaps the best starting point for all treatments, okay? We just wanted to improve the patient's understanding and perhaps in others who don't suffer from it, improve understanding of the patient in their predicament. Maybe help people in taking a step forward. Maybe give somebody a little hope that they could actually make a difference in treating this thing, okay? Baby steps, but they matter. Micro treatments, as we've explored, in my humble opinion, they matter, though a bowl of soup or a walk in the woods will probably not cure you. It has an incremental stacking effect, and in the same way that you take a pot of water and drip drops into it, it eventually fills up, okay? No one drop might matter too much, but if you keep putting drops into a bowl of water, it fills, right, over time. Okay, now what might the causes be, given that a perfect theory is unknown at this time? Here's just a bunch of ideas from our fourfold model, right, of causes, right? Biochemistry and genetics, a lot of focus is placed on that nowadays, and I think that is a very good place to start, but poor practices in terms of diet, sleep, exercise, and illicit drugs or intoxication, I think those could have an effect on the physical level, right? Now, exercise, I would give you points almost for taking another antidepressant that doesn't have any side effects except for you need discipline to do it, okay? I've noticed many types of exercise, simple walks in fact, to weightlifting, to yoga, to cardiovascular stuff can have a huge antidepressant effect and can cause a little bit of an endorphin, not really rush, but circulation of endorphins and give one a little bit of a boost, okay? And more so than you would think, right? So here are the other things. We explored the great psychologists and doctors of all time, Sigmund Freud and Carl Jung, and the concept of loss is maybe not the only cause, but definitely, in my mind, a contributing factor to the big picture of this whole thing, okay? And these losses could be conscious or unconscious. They could be accessible to the brain or not even accessible in the recesses of your brain, repressed, pushed away, not quite fully understood. Okay, and these can be explored in various therapy sessions, I think. Psychoanalysis, the techniques of the old days have gone out of style. However, one that usually has in therapy and the choice of what to address to a certain extent, right? And I think addressing some of these areas, such as loss, anger, where it's present, where it's directed inward, trauma, obviously, all of these can allow us to focus on and attack, for lack of a better term, the psychological angle of this thing. We had Aldous Huxley add to the social and spiritual factors that, there may be many causes, and a lot of those causes can culminate in a loss of meaning, which is kind of a spiritual despondency, a hole in the soul feeling that can really be dragging. Okay, I would like to point out that spiritual treatments, including religion, going to church, whatever one prefers, okay, connection to something spiritual in nature, but that could be very religious. I just don't want to comment on that specifically because of the varieties of religious views and beliefs. They can, in fact, treat the problem of depression on numerous levels simply because, attending an event at a church could allow you to engage in social connection with positive people, spiritual connection with whatever your spiritual connection is, even physical if you're moving around doing something, okay? So I think those are very powerful. Support groups and stuff like that allow you to check off many of these areas at once, right? The only other question I'd ask, and I need to ask this for myself often too, is where are the weaknesses in this? Where is my weakest point? Oftentimes the weakest link is the thing to address first. Maybe not always, but I think that's well worth looking at, okay? Where is lacking at this current time? Just wanted to remind you of Huxley's terms, the maladjustment of consciousness, or the dark lens through which we see reality, which is somewhat analogous to the mind itself, right? These are changeable. Remember that. You're not stuck with a dark lens or a maladjustment of consciousness. Consciousness can be altered, adjusted through various means, including legitimate use of modern pharmaceuticals, but I don't comment on that because I'm not a doctor. But meditation, mindfulness practices. I would even go so far, and we didn't get into this, as to say that practice of morality and virtues could have a slight effect on this, okay? That's, a topic for another day, and I didn't get into that, but even that might have a slight effect on the, enhancing or adjusting of consciousness, just cleanliness or, frugality or something like that. Cleanliness, allowing you to feel a greater sense of mental peace when you look around the room. Frugality allowing you to not engage in unhealthy money activities and to feel good about one's management of their whole life in at least the financial context of it, right? There may be a role in that, and that's something unexplored that I would invite anyone else to get into and explore, all right? But important point, consciousness is changeable, especially through effort, right? Remember, treatment on these levels has been my personal and experientially best producer of results, okay? And alleviation of depression. I wish I'd known it years ago. That's one of the reasons I'm changing it. And remember, they're all changeable, flexible, so you can provide the change, okay? You can, through taking responsibility for the whole thing, address areas that you want to change that you think might be the most effective in treating yourself and your condition, right? We did a little diagram in one of the presentations where the mind comes first. This is from Buddhism, I think. The mind, then mental phenomena, right? And then from that, not Buddhism, mental narratives come out, which are just stories one tells oneself about the nature of things, the nature of oneself, one's life, etc. But the problem is emotions come in, right? And because of the distorted lens or mind that we're dealing with at the beginning, the narratives come out wrong, and they involve a lot of charged emotions and can harm us greatly, and oftentimes they are not even true, right? Very dangerous and something to be aware of, how the whole mind works, how that dark lens might affect you. So if you see a bad mental narrative going on, just question the fact that, well, the lens might be there, the thoughts might be a little, polluted with negativity, and the narrative could be wrong, okay? I want to remind the person, and I put this in bold, that with loss or even trauma, putting it into a proper context promotes healing, okay? Can help us make meaning. Loss of meaning is a big theme, according to Aldous Huxley. Help us make meaning and know and feel that our suffering has not been in vain, okay? Very important. Remember that one, please. Here are just a bunch of ideas. I don't think we got into all of these, but a lot have to do with Aldous Huxley and just things to adjust that may adjust consciousness itself in a more positive direction. Polish off the lens a little bit, okay? Just exposure to sunshine. Minimal things like that can make a large difference, all right? I'd like to remind you, this is only a patient's perspective. It is not a medical perspective or anything like that. Just a few points that I've learned over the years. Not a definitive map on all of depression, how it works, and how to treat it. We just took a intellectual and hopefully compassionate approach, crunched the great geniuses that we found together, and probably added a little bit of compassion to that. Although Carl Jung was a very compassionate guy. I mean, maybe the others were too, but Carl Jung, you could tell he really cared through his writings, etc. Right? So I'm attempting to help others understand and feel understood, find some possible causes, though no real cause or causes are definitively known at this time, and give some hope, right? One of the things we talked about in our example quotes from Tupac is the feeling of hopelessness. A very big point in this thing. Without hope for the future, or anything bright in the future, it makes it very hard to move forward or even take action to treat it, okay? If the future is hopeless, no